So welcome everyone to the monthly Ontario NEIHR webinar series for July 2022. My name is Suzanne Stewart, and I am an associate professor of public health here at the Decolonizing School of Public Health at the University of Toronto. I'm also part of the Ontario Network for Environments and Indigenous Health Research. And I'm coming to you here today through the Ontario Network for Environments in Indigenous Health Research, Ontario NEIHR for short, with our monthly mental health webinar series where we bring Indigenous leaders and mental health experts from across Canada and across who are embedded throughout our NEIHR network to share their work and their research, their clinical work, whatever they have to share with everyone to help us work together in a good way to address the mental health challenges of Indigenous communities throughout Turtle Island. So before we get started introducing our speaker for this month, we're going to ask Roy Strebel, who is the Ontario Network Coordinator, to open us up in a good way with a spiritual opening. So Roy.
Makwa, Dr. Stewart. Hi, everybody. I'm just going to start us off with a little bit of a smudge here. I'll be using some of the sage that I use regularly. I'd just like to acknowledge the four directions and thank Creator for bringing us together this morning to listen to this important work. Also, I'd like to acknowledge all the creatures, the four-legged, the two-legged, the swimmers, the climbers, the hoppers, and just asking Creator to watch over all of us today and just enjoy the presentation. Miigwech.
Miigwech, Roy, thank you. Merci Cho. That was beautiful. So without further ado, we're going to introduce our speaker for this webinar today, and that's Dr. Renee Linklater. I first met Dr. Renee Linklater at OISE when we were both there in 2007, but it feels like yesterday. And you still look the same, and you're still doing great work in the community and you've really made large impacts with your work. And I think that's what you're here to share with us today. So Dr. Renee Linklater is the Senior Director of the Shkaabe Makwa program at CAMH here in Toronto. And I will let Renee, who I'm very honored and thrilled to know and work with over the last 15 years, I will let her introduce herself in depthly and share her work with you. And I'm really thrilled again to have you here, and it's a great honor to be working with you. So merci cho, thank you.
Miigwech so much, Suzanne and Roy, for your opening and introductions. Bonjour, everyone. Ojaushkam Banas Minwa Manager Constitution Gazak. Manager about to go na Dunji, Nagikta then Minwa na Deman Tiktodem. I feel so this is such a great privilege for me to sit with you all this morning and share with you some of the work that I've come to do. And in my introduction, I shared my Anishinaabe names, and I'm from Rainy River First Nations, which is in their traditional territory of Treaty Number 3 in Northwestern Ontario. And you know, it's interesting. I have such a long history with this group, and was originally, when I was doing my PhD at OISE, I was one of the, at that time it was called the Cadre, but now it's called the NEIHR. But I was one of the PhD students that was funded and to do my doctoral research. And one of the networks that I really miss are actually those student gatherings. And I remember when I first went to my first one in Quebec City, and I was listening to all these amazing Indigenous and non-Indigenous researchers share about their work, and how not only inspired I was feeling, you know, listening to those presentations, but how much I came to realize the importance of, you know, being within this research space. And so I feel that, you know, much of our journeys throughout our lifetimes become connected in different ways. And so if anything, that I would say that my doctoral research, which some of you might be familiar with, resulted in a book called Decolonizing Trauma Work, Indigenous Stories and Strategies. And moving on from there, I went to work at the Center for Addiction and Mental Health, which is a mental health hospital in Toronto. And it's really, I would say, given me this opportunity to put my research into practice, and really being able to kind of, you know, step forward into a space and work alongside, you know, an amazing team and many colleagues across the organization to, you know, not only improve care, but really, you know, figure out ways that we can shift the system. And so I just want to say Chimigwech for this time to share some of the work that we've been doing. And of course, my slide deck is probably gonna tricky. The first, you know, kind of first and foremost, what's become really important is to acknowledge the land. And for CAMH, you know, there's a long history in terms of our hospital. And, you know, in 1998, the provincial government and the Ministry of Health kind of actioned the merger of 4 main mental health and addiction services in Toronto. And the reason why they wanted to do this is because they felt that things were very siloed. And so at that time, 4 mental health centers came together to form CAMH, which were the Queen Street Mental Health Center, the Clark Institute for Psychiatry, the Donwood Treatment Hospital, and the Addiction Research Foundation. And but what's really important is that to acknowledge that the roots of the original hospital, the Queen Street Mental Health Center, which you see the images on the top right and bottom right with the wall, that was actually, this hospital was constructed in 1850 and was at that time known as the Provincial Asylum for Lunatics. And when we were doing some archival research around where, you know, where the hospital now sits, what we discovered was that this was actually the grounds that the Mississaugas used to come and camp and hold their council meetings. And so this is something that we continually reflect on when, you know, we're doing our work, particularly with our board of trustees, with our executive leadership, to continually, you know, remind ourselves about what takes place on these lands. And the other thing that's kind of interesting about our hospital being, you know, the original hospital being built in 1850, and I think about this with, you know, institutions like University of Toronto as well, is that these institutions were, you know, building roots within our land prior to Canada even becoming a country. And so that was the other piece that becomes important to recognize, is that this area is covered by the Toronto Purchase Treaty number 13, which was signed in 1805. And now we honor that the Mississaugas of the Credit are the guardians of this land. And, you know, organizationally, it's become really important for us to communicate and be able to have our land acknowledgements present right across the hospital in many physical spaces as well. And in June, as part of our events for National Indigenous History Month, our team had released the guide for honoring the land and ancestors through land acknowledgements. And so I just wanted to highlight that's available on CAMH's website if you're interested. And there was also a webinar that was recorded as well that was presented by our reconciliation working group, which were the ones that brought forward this land acknowledgement guide. And I've been at CAMH for 11 years now, just over 11 years, which I have to say, it was interesting that I ended up there. And many people in the beginning, were asking me, given all your work in critiquing psychiatry, how is it that you end up working, at a mental health center? And it's very easy for me. And even when I think about the opportunities that we have, but at the end of the day, our people end up in hospital. So I really believe that we have to make this system better as well. And we've made a lot of advances, I would say, within this organization. And the only explanation that I've been able to really land on is that we've been able to move ahead because we are a learning organization. And the areas around health equity become really important in terms of helping our leadership understand why it is that we need to have specific services for First Nations, Inuit and Métis, and helping them to understand the kind of the history through colonization and some of the injuries and wounds, and how that has really manifested for many people in struggling with various mental health issues or substance misuse issues or behavioral addictions for that matter as well. And also, it's really important that I brought forward for our leadership is our population, and the fact that we have a very fast-growing population. Our youth population is like one of the fastest growing in the country. And there's also a lot of other areas that become important in terms of our community leadership, our placement in this country as rights holders. We are legally defined as First Nations, Inuit and Métis people, which is different from those that might have Indigenous ancestry but might not be legally recognized. And I think there's a lot of very interesting conversations that are happening right now around Indigenous identity. And but I really kind of land on those areas that for someone that's legally defined as being First Nations, Inuit, or Métis, we're rooted in our families and we're rooted in our communities and cultures. And also important to kind of reflect on is the royal commissions, of course, that have taken place. So, not only the first one in 1996, but also the Truth and Reconciliation Commission. And what I'm realizing I need to add in here is the important work that, has taken place around murdered and missing Indigenous women and girls. An important way for us to kind of connect into national priorities is to pick up, initiatives like the Truth and Reconciliation Commission's calls to action. And so this is something that, our leadership is able to really, understand that we have a place, in terms of ensuring that we have culturally relevant services, that we have traditional healers, and that we offer these types of services to our patients when they're interested in receiving those types of services. And some of the strategic work that we did was back in, I would say this work really got underway in around 2014, where we set out to really better understand what is it that we ought to be doing as a mental health hospital in Ontario. And, we do have provincial scope. So even though our hospital services are located within the city of Toronto, many of our programs are specialty programs. So we have patients come in from across the province. And so that's been really important in terms of our relationships as well. And just to kind of share, CAMH has about 4,000 staff. So it's a very large organization, and it's known as Canada's leading research and teaching hospital. And so when we developed this strategy, we had internal consultations with a number of Indigenous and non-Indigenous staff. We had an external working group of leaders that were working in our different service provider or political representative organizations in the province. And that was really helpful to be able to help guide us in not only what we could be doing and offering supports, but also what we shouldn't be doing. Because I'm really mindful that there's hospitals and health services across the province. And, there's a need to kind of be in this space where sometimes there's opportunities to, be a service provider. Sometimes there's opportunities to collaborate on service delivery. But then, other times, we know that communities are being served quite well. And so, we just look to be, I would say of service. And we get a lot of calls, I would say, and requests coming into us now based on the type of work and strategies that we've been able to put forth. And CAMH, as I mentioned earlier, as an organization, it was formed in 1998, and Aboriginal Services was created in 2000. So it's just coming up to 22 years old. And because of those services and our experience in working within the hospital and working across the system, following guiding directions and many of the priorities initiatives that we were working on, we ended up really thinking through what is the best way to be able to support our patients, and our service providers and communities across the province. And so we launched Shkaabe Makwa as a Center for First Nations Inuit and Métis Wellness at CAMH. And there are a number of centers, mostly research kind of focused, but some are very much connected to patient care as well. And so this has been really exciting. It's an item that sat within the CAMH strategic plan, One CAMH, which was launched in 2020 and is aimed to be completed by 2023. And so this has been, I would say, a really important milestone for us to be able to step really concretely into the hospital system. And it's really important for us. We feel that, the work that we do is very spiritually grounded and guided by, many different factors. And whether that's, our spiritual relationships. When we talk about Shkaabe Makwa, Makwa means bear, and Shkaabe means Shkaabe in the Anishinaabe language. So when we put that together, Shkaabe Makwa, it means spirit bear helper. And what CAMH from time to time had developed these community advisory groups that would help maybe design one of our inpatient cycles, for example. We've had men's cycles and women's cycles previously for addiction treatment. And then through some of our engagement work across the province, we've really developed very strong relationships with many, leaders, health leaders, mental health leaders, hospital leadership, and other service providers and researchers. And initially, we, kind of came up with this list of 11 people that we thought would be amazing to be able to invite them onto our leadership circle. And so we did. And as we put out these invitations, we kind of prayed that, hopefully at least, 7 people would have an ability to participate in our leadership circle. And each and every one of them in the end ended up accepting. And, for myself, it was, a huge leap in faith of what it was that we can do together. And so I'm really honored to be able to work with this leadership group. And we convene every 6 months. But, given that we launched in the pandemic in November 2020, we actually haven't had an in-person meeting, and we're really hoping to be able to, to convene them in person in September, if that's possible. But given we're also, kind of in this area of a 7th wave, we'll kind of have to see how that goes. And I just wanted to share a little bit around Aboriginal services. And these are some photos. I always like to acknowledge the original team. And of course, Chipin, Nassin, Vern, Harper was an elder and healer at CAMH, and his role was really important. And he was, along with him and 4 therapists and a manager, were the original team at CAMH. And so I always want to, I always reflect back on these were the folks that, stepped into this space, they planted the seeds, they pushed the boundaries, and they developed these services at a time when there was a lot of, I would say not good understanding about the ways that we needed to really provide care to First Nations, Inuit, and Métis people. And bringing our senior leadership, our former CEO, Dr. Catherine Zahn, who last August became the Assistant Deputy Minister of Health for the Province of Ontario. So in the center photograph at the bottom, the woman with the hat is Dr. Catherine Zahn. And the woman to the left is Lori Spadorcha, who is still on our executive leadership team as Executive Vice President for Communications Partnership, and she's also Chief Strategy Officer. And so, we purposefully had 3 senior leadership trips to Indigenous communities. And in 2013, we first went up to Thunder Bay, and then to Sioux Lookout and to Lac Seul, where we would meet with groups of Indigenous leaders, chiefs, health staff. And, that was really important. That was kind of, the first time our executive leadership had taken a whole week out of their schedules to be able to meet with our folks. And in 2016, we went up the James Bay coast, and we wanted to go into remote communities that, had a lot of other issues around accessing healthcare. A lot of the ones, are very insular. So the experiences that they've had have been somewhat different from other First Nations that are more rural, or more closer to urban communities. And then in 2018, we went to Six Nations and Mississaugas of the Credit. And I have to say that it's been, critically important, not only for our senior leadership to go out and to, have these conversations so that they can better understand what our role might be as a service provider, but for the chiefs and health staff and community that we were able to meet with, to be able to have CAMH leadership come out and listen and really have a genuine interest in learning has really helped build trust, I would say, in terms of our relationships. And, we continue to be present in the community in terms of our team, our staff, both, locally and internationally. And, I know that CAMH has a responsibility within Ontario, but when we think about, Inuit populations, that center photograph was taken in Baker Lake, which is a hamlet in Nunavut, and that was during the National Inuit Suicide Prevention Gathering. And I've also been part of Ministry of Health engagement trips when they've been flying into remote communities. That's the bottom right, and also in that photograph, some of you might recognize a former Assistant Deputy Minister Sharon Lee Smith, who's just to my right. To the right of her is Dr. Lisa Richardson, who's First Nations. She's an Shkaabe background and is also a lead at Women's College Hospital and has a very prominent role at University of Toronto. And then our current assistant or deputy minister, Sean Batiste, with Indigenous Affairs, is on the right. And as part of the guiding directions, work that we did and some of the actions that came out of that, there was a clear action to increase the First Nations, Inuit, and Métis representation on the CAMH Board of Trustees, as well as the Constituency Council. And so currently we have Diane Smiley, who's Métis, She's a nurse by background and has played a really important role along with Sanya's in the Indigenous cultural safety training area. And and then as part of our constituency council, which is a provincial group, we do have different First Nations, Inuit and Métis people that are part of that. And for myself, I think that that's really important because it also gives our people opportunities to be able to participate in these broader groups and starting to make, you know, the connection between hospital and community healthcare. In 2016, we opened up our ceremony grounds at CAMH, and you know, this has medicine gardens, it has a sweat lodge, and we've had a lot of interest, I would say, both internally, not only from clinicians and psychiatrists, psychologists, and social workers, in wanting to learn about how can these Indigenous healing methodologies help the patients that they're seeing as well. And also our executive leadership team in 2018 requested the opportunity to go into the sweat lodge. So that's the photograph on the left. And there's an article on the camh.ca website if anyone's interested in learning about their experiences, which I thought were really important. And I remember saying to Catherine that, you know, previous to them going into the sweat lodge, I really felt that they supported the work that we were doing, and maybe not necessarily understanding all of the components. But after they went into the sweat lodge, I came out with, I wasn't in the sweat lodge, but after their experience and what I had gathered from it, it really shifted in how I felt our executive leadership team, you know, was positioned, and that now I actually felt that we were walking this road together. And I would also say that I have become a lot more bolder in what it is that I'm prepared to say to our executive leadership team and our board of trustees, where previously I would feel a little bit hesitant to share the extent of you know, ceremonies and other ways that we bring forward our work. But what I make very clear to them now is that the you know, the abilities that we have to pull together these services and convene this type of work at CAMH is not just because we have PhDs and masters. It's really because we're spiritually grounded. We understand our cultural teachings, and we really bring that in the centerpiece of our work. And so this photograph here was taken at a ceremony when previous to opening the ceremony grounds, where we were asking permission from the creator and from our helpers and ancestors to be able to have these ceremony grounds at the hospital. And we also had to do some ceremonial and spiritual work in terms of helping some of those wounded spirits that had, you know, previously been patients at CAMH, and some, you know, patients died at CAMH. And they haven't necessarily been able to get to where they needed to get to in terms of their transition to the spirit world. And so we needed to do some cleansing of the hospital campus as well. We also are largely involved in policy review and development. And, you know, we have a traditional ceremonies policy that really kind of sets forward not only the way that, you know, we're going to conduct ceremonies at CAMH, but it helps us, you know, better understand what some of the protocols are. And so, you know, so this is very kind of full in terms of when we're holding sweat lodges, what we need to do in contacting the you know, City of Toronto Fire Services, you know, when we start a fire, when we put out the fire. But we also, you know, within the CAMH tobacco-free policy, there is a clause that, you know, because we're a hospital, of course, we're tobacco-free, and this followed the Smoke-Free Act within Ontario, but we ensured that we're permitted to, you know, use tobacco. We can purchase it, we can grow it on campus. But the one thing that I did want to make sure is that this was done under the supervision of CAMH's Aboriginal staff or Aboriginal Services staff. And of course, some of the language feels a little bit outdated now, But what I didn't want to have happen was our spiritual care department to be able to, kind of take this on themselves as non-Indigenous people. I really wanted to make sure that we were doing this responsibly and respectfully in terms of our culture. We have an Aboriginal caucus at CAMH, and it has almost 40 members at this time. And, we're working in various different programs right across the hospital, whether they're in, one of our clinical programs, research department, education department, our gifts of light. And it's become a really important place for us just to kind of convene. Sometimes there's issues that we need to advocate on. There's areas of racism that we've had to discuss and figure out how do we support our colleagues, or, what do we need to do in terms of connecting certain patients to client relations to be able to, address some of the ways that CAMH has provided care. We also have a reconciliation working group, and this is a group of Indigenous and non-Indigenous staff at CAMH, and they put on a speaker series that was really important in terms of bringing forward different opportunities for our colleagues to learn. And we know that many of our non-Indigenous colleagues have had a genuine, drive to be able to do something, right? When we think about what has happened, what's taken place, especially as we learn more. And so this is a very, important group at CAMH. And last year, we won one of the Health Standards Ontario's leading practice, which I think is really positive in terms of, really showing what hospitals and other health system, institutions might be able to embark on. We launched a Truth and Reconciliation Action Plan. So this also is online, and there were a number of items to be implemented as well. And and some of these have really, significant resource needs, when we think about item number 4, where we want to see all of our staff and physicians have access to Indigenous anti-racism, anti-oppression, and cultural safety training. And so when we have initiatives like this, then it comes back to the organization about how are we going to resource these important areas. In 2018, we held our first powwow at CAMH, and this was just such a beautiful event. It was the first time that we had held a powwow, and we had over 800 people, from the CAMH community and from, the wider Toronto community come down and celebrate with us. And what was really beautiful is the bottom center photograph is that we have a CAMH daycare on site, and at 3 p.m. they had arranged to bring all the kids to the powwow, and they were able to come in and have an honor song. And that just really warmed my heart when I saw all these young kids, and some of their parents were present for that too, which was nice. But one of the other stories that really was meaningful for me is later in the day when we were debriefing with staff, we learned that there was a patient that was in one of our inpatient units and had been for quite some time and was really struggling, very depressed, low affect, and not engaging very much with the CAMH nursing staff and other supports. And when this person heard the drums outside, came to their window and looked out and asked if one of the nurses could bring them down to be able to to be where this was taking place. And I remember and they arranged that too, which I thought was really important, especially when we have people that really need supports and escorts in order to kind of come out of the unit that they're in. And I thought, for that person to be able to be, inspired and to feel that spark of spirituality and life, that's the power in, the drum and some of our healing methods and other cultural approaches that really help people, come to that place of connection. In terms of our patient care, this is an area that, of course, we have so much work to do, but really recognizing, the advances that, we've even been able to make, even in the last decade, as we've been on this redevelopment, mission. And so some of the earlier pictures that you saw, with the stone wall is still there. But there has been a concerted effort to take down the, older gray, really mundane buildings and be able to put up new spaces. And so this is actually what our Queen Street site looks like. And, on the top left where we have our crisis and critical care building, that houses our emergency department. And so for decades, that was actually located at our College in Spadina site, which was the former Clark Institute for Psychiatry. And just a couple of years ago, we brought that service down to Queen Street, along with a number of other services. And so this becomes really important, I would say, in terms of having a place of care that people feel comfortable and to be at. When we look at some of the art that is in the top right corner, that was done by a Cree Métis artist. And we also have hospital spaces where patients have their own rooms now in many of the new areas and their own private washrooms. And so, really kind of tending to what patients need in order to recover, in order to be well. And for our Aboriginal Services program, which has 4 clinical staff, it has a healer, it does a number of outpatient programs. We do not have a specific inpatient unit for Indigenous patients, but what we do is we're able to support when there's First Nations, Inuit and Métis patients in various units right across the hospital. So whether that's in the women's program, in our youth inpatient unit, in our forensic unit, our law and mental health, we're able to go out to those units to support them. And, because we've been looking at the data and, see the numbers of First Nations, Inuit and Métis folks that have been coming through our emergency unit, we now staff kind of like a caseworker, a bit of a patient navigator, one of the Aboriginal Services staff in our emergency department from 1 p.m. to 9 p.m. from Monday to Friday. And this has been really important in terms of helping to advocate for services, helping them to kind of, get through the CAMH procedures, and also help with admissions as well. And other areas that we support are through virtual care, and whether that's our telemental health services, so access to psychiatry. This can be done through kind of our online portal. If someone across the province is in need of a psychiatric assessment, their service provider can, kind of request services through our system. We also have a service called Integrated Care Model, which provides every 2 weeks direct and indirect care to a service provider. And this is really around extending care. And we have many of these right across the province, but 9 of them are with Indigenous service providers or First Nation communities. So 4 remote communities receive this service right now. We're also delivering to Métis Nation of Ontario, as well as a number of the Aboriginal Health Access Centres in Ontario. And then we also have a really interesting program called ECHO, which is the Extension of Community Healthcare Outcomes. And we've run 5 cycles of these. And this is where we have a team in Toronto, and that's the photograph on the top left. That's known as our healthcare resource team. And so we convene every week, and it's a 2-hour session, and we have service providers convene by Zoom from right across the province. And, we've completely culturally adapted it. We have an Indigenous host that hosts. We have a traditional healer that does the opening and that is part of the care recommendations team. And we offer out a presentation you know, of where, you know, there's a mental health issue. It could, you know, that's prevalent. It could be on trauma. It could be on suicide. It could be on substance misuse. And then the service providers, and this is all arranged ahead of time, are invited to present a case of where they're looking to have some recommendations to support one of their clients. And so for an hour, we all collectively discuss, you know, the client. It becomes a shared client, and then we write up the recommendations and send it out to the service provider. And this has become a really important service, I would say, and we're looking forward to launching our 6th cycle in October. And then the last, or the other, one of the other portfolios that I just wanted to spend a little bit of time talking on was our wellness innovation. And this captures our provincial initiatives that we're involved in. So, you know, because CAMH also has a provincial system support program at CAMH that works across the province. And actually, our former program, Aboriginal Engagement and Outreach, was actually part of our provincial program, which was really helpful. And even though we've launched out in our new center at Shkaabe, Makwa, we're still largely involved in all of these provincial initiatives. So that's been really helpful, whether it's, you know, filling the gap around stage screening and assessment training. You know, we've got a role in the Indigenous stream around the Ontario Structured Psychotherapy Program. There are youth wellness hub sites across the province, and our team supports, there's 2 now Indigenous-led one, and there's a number of evaluation and research projects that we become involved in. And one of our other exciting provincial initiatives that we lead is around workforce development. And initially, this was called the Mobile Training Teams Initiative. And, you know, the province began funding us for this back in 2014. And, you know, initially it was only for Northern Ontario, but over the years, we were able to work with the Ministry of Health to expand that to be a provincial program. And so this program has hub sites. I mean, when we were in person, we were having hub sites right across different areas and offering out training, much of which is delivered virtually as well. And we've also started having provincial gatherings. And so this was another negotiation piece with the Ministry of Health. And so we've had, you know, our first one in 2019, that was in person, and then we had to have a virtual event in 2021, and we're planning to have another event in this coming up year. And some of the areas that we're working on is around, you know, intellectual and developmental disabilities, and strengths-based strategies for challenges at school. We've got an Indigenous helper program. And we also work with different therapeutic modalities like acceptance and commitment therapy. And each of these curriculums are created alongside an advisory group that includes, you know, Indigenous clinicians, knowledge keepers, elders, and that's been a really important process piece, I would say, for us. And in terms of some of the research that we find ourselves being involved in, because CAMH has, as I mentioned, a number of research centers, but a very strong research role internationally. And so we both lead work, we both lead research projects ourselves. One of the ones we're working on now is a gender and wellness initiative. And then we're part of a number of research projects alongside of our colleagues, and I'm co-PI on a number of initiatives as well. And some of our projects work directly with First Nation communities. We've got a First Nations wellness initiative that we're just, you know, wrapping up this phase of it. But it has worked intensely with Saugeen First Nation, Walpole Island First Nation, Kettle and Stony Point, and Aamjiwnaang, and NEIHR, which are in Southwestern Ontario. And these would help the communities develop their mental wellness strategies. We've got a CAMH lab that we send out, we hire community-based researchers, we help train community-based researchers, and they become an important, you know, I would say conveners in moving forward these types of projects. And then with our team at CAMH, I would say that we're we're called on a lot by our colleagues, and so this kind of puts us in the position that we bring together different products and different resources to be able to support the work of the organization. And so whether it's a guide or on conducting research with Indigenous peoples of Canada, because a lot of our colleagues really needed some advice. They really needed something to kind of think through if they wanted to be working with our communities. We put together a language guide for our public affairs about when writing and speaking about Indigenous peoples, and then many of the evidence briefs we might put together or other briefs that help support some of the content areas that we need to kind of think through. And at the beginning of the pandemic, our team felt a lot of heaviness, as a lot of people did. But if anything, we knew we needed to step up quickly to be able to put something out of support. So we put together this infographic and this webinar, which shared out the cultural values and care concepts during the pandemic. And this is available on our website if you're interested. And also, one of CAMH's taglines is mental health is health. And, when this was brought forward a few years ago, so many people just really connected into that. And we had Diane Longboat, who's CAMH elder and senior manager for strategic initiatives, work with a number of our language speakers to be able to translate mental health is health. So we have this available as well. And then I guess it was back in 2020, we released Connected in Creation, which was a collection of 15 stories and writings from First Nations and Métis staff at CAMH around our own lived experience. And we know that we convene the system, and living and lived experience of Indigenous people and other peoples for that matter becomes really important in bringing that forward in some of the systems initiatives. And we recognize that as professionals, we can't take up that space and that voice for community when we're convening these groups. But, because many of us have our own experiences, we wanted to be able to share that out as an invitation for others to join us in this work. And the last thing that I just wanted to share with everyone is this video called Mind Chatter. And when we first had kind of hit the ground running, when we got the contract with Ministry of Health to deliver the Mobile Training Teams initiative, we were gathering resources from everywhere and kind of anywhere. And, one of our trainings was Dancing with Spirit. So it was on motivational interviewing. And some of the feedback through our evaluations are always so critical. Some of the feedback was that it would be really nice if that the resources that we were utilizing in the videos were more representative of Indigenous peoples and Indigenous cultures. And so we ended up, we've spent years now developing resources and content to be able to use in our programs. So I'm just going to share this 1-minute video. Oh, sorry.
So nice to be out here. Not supposed to beat myself up. I left dirty dishes in the sink. Why am I so stupid? Mom would have a fit if she knew. Can't remember. Gotta get some groceries. I keep on forgetting to pick up laundry soap. Why am I so stupid? Going to try. Can't remember anything. So nice. Oh yeah. I'm supposed to be taking a mindful walk. I left dirty dishes in the sink. Be present. I can't even do that. Wow. Right. I can't even do that. Mom would have a fit. Oh yeah. If she not knew. Supposed to beat myself up. Gotta get some groceries. Accept my thoughts. Going to try. Breathe. That was nice. Focus. Feel my feet touch the ground. Breathe. I can do this.
Miigwech, everyone. I'm going to stop sharing my slides just because I'm hoping we can see each other. I know we've got a few minutes for questions or comments.
Well, Renee, I have to say, Dr. Linklater, that was really, really amazing. Well, I mean, there's so much information that you shared, and that video was really an amazing place to finish it with. And I'm kind of speechless for a second. But I'm just wondering if anyone has any questions. We have sort of a smallish group here. So because it's summer, I know a lot of people are away. Maybe we could invite, I actually know almost all the people who were in the audience. So maybe I'll invite them to ask any questions, to turn on their camera and ask their questions if they have any, or make their comments. And while people prepare to do that, I do have a question. And so, and it's kind of related to the video that you just shared. I mean, I have a lot of other questions, but I'll stick with that. So where is that video accessible?
If you Google Mind Chatter CAMH, I believe you can find it. It's within our YouTube channel.
Oh, CAMH has a YouTube channel. Okay.
Yeah, I want to make sure that that's still there.
Okay. Maybe we can put the YouTube channel in the chat. That would be great for people, because I'd really like to see more of those. And I know actually CAMH, I've been sitting at home watching TV, and a CAMH ad will come on with a Native person. And I actually started crying when I saw it, because it was so good. I actually got emotional. I think it was about suicide, actually.
Yeah, so we have a CAMH Foundation, and we have a discovery fund, which is to kind of raise issues and do research around suicide. And so one of our commercials was created for that purpose. And it has Holly Smith in it, she had many roles at CAMH, and she's currently our manager of workforce development. So she was the person that was in that video.
That was amazing. And I've just been informed by our person who knows everything here, Roy, that people can't turn on their cameras because it's a webinar format. So my apologies. So if there's any questions, please post them in the chat or in the Q&A. I guess one more question I have, and maybe you answered this, but I feel like a lot of people are still very suspicious and mistrustful of hospital settings, including CAMH. And I just wonder what it's like for you as Indigenous people who are doing things in a good way, like all the spiritual ways you've talked about today, to keep trying to deal with that without getting worn out, I guess, maybe, or really bogged down with that, because it is a heavy thing to always be trying to represent or change a system that doesn't want to change, but yet we know our people need these services, so we want to provide them in a good way. It's a very difficult place to be, where you and your staff are.
Yeah, I mean, thank you. That's such a great question. And I would say that we feel both really inspired by the ability to be able to support our people when they come into hospital, but it's not always easy. And some of the internal stuff, we're a large institution, and so it hasn't always been easy. But I think that when we I would say that our team and our staff really come to work with their big hearts and their boots on, and really ready to withstand whatever it is that we need to do to make the system better and to make the hospital a safer place. And sometimes that's really disheartening, when we're hearing incidents that are happening over and over again. But I think that's the commitment to continuing to elevate and to advocate for these issues. And to really, begin to address the racism and discrimination that is in our healthcare system. It is. And our senior leadership say that we're a colonial institution, like they're owning that. And that's been really important, that we feel that at least we're in an environment that is prepared to shift. And like I said earlier, is prepared to learn. And we have many people, and I just want to say thank you to Vanessa for your comments in the chat. Vanessa's a PhD student who's doing exceptional work, and CAMH is her research site. And so these relationships become really important, that we have to work together inside the walls and outside the walls as well. And also noticing that Michael posted almost at the same time the YouTube link to Mind Chatter. So miigwech for that, Michael.
Well, fantastic. So I think we're out of time now. So I want to say thank you so much to Dr. Linklater for doing this wonderful presentation and sharing with us all the great work that they've been doing at CAMH and all of the personal and professional commitment that you and your group has. And thank you to the audience for attending this Ontario Monthly NEIHR series, which will be posted on our YouTube channel. It's the Wakabiness Bryce Institute for Indigenous Health YouTube channel. Roy will be putting it up there, and it'll also be linked through the Ontario NEIHR website, so you can go to either to find it. And to thank Roy for coordinating the event and providing this spiritual grounding. And just to advise everyone, we're not going to do a webinar in August because everyone's away, and I think it's probably difficult to get people to come together in August. So we're going to take a little break in August, but we'll be back in full steam in September. And who's our speaker in September, Roy?
Sorry, I don't have it in front of me, but it will be on the website once we have confirmation.
Okay, and then just to let you know, we have our annual Indigenizing Health Symposium on September 28th and 29th in Toronto. We have met like a whole load of keynote speakers, a panel, an interactive workshop, graduate student posters. All that's going to be out on our website in the next day or two for registration links. So please hold that date, September 28th and 29th in person at the Native Canadian Centre on 16th Spadina, just like it used to be when we used to hold those conferences every year all together. So Masi Cho, and thank you again. And I'll turn over to Roy for our spiritual closing so we can end in a good way.
Stewart, I'd just like to thank Dr. Renee Linklater for that absolutely interesting presentation. But right now, I'd just like to just ask Creator to watch over us during today and to keep us safe. And everybody enjoy the rest of your day. Miigwech, miigwech, miigwech.
Miigwech. Bye-bye.